Hey guys, now we are going to discuss about osteoarthritis from Roga Nidana, that is pathology. Here you can see a healthy knee joint and a knee affected with osteoarthritis. See depletion of synovial fluid and articular cartilage from knee joint, which results in osteoarthritis. Before moving to the topic, let's have a look at the case study. A 55-year-old female complains of bilateral knee joint pain since 6 months. Let me put some questions before you. What is the onset? That is a sudden or gradual development of osteoarthritis. What is its duration? Are there any other pains? Is there morning stiffness? Are there any aggravation and relieving factors? Do you see any inflammatory signs? Introduction. Osteoarthritis is the most common type of arthritis. Osteoarthritis is also referred to as wear and tear arthritis and degenerative arthritis. Weight-bearing joints are most commonly affected. Most patients have increased joint pain during activity, which is relieved with rest. Disease is more prevalent among older people, so it is an old age arthritis. Women are more affected compared to men. Early diagnosis and treatment is important for successful management. Definition of osteoarthritis. Osteoarthritis is a non-inflammatory, degenerative condition of the joints characterized by degeneration of the annular cartilage and formation of the new bone. In this image, you can see a gradual breakdown of cartilage, which results in the osteoarthritis. Etiology of osteoarthritis. What is primary osteoarthritis? When there is no obvious predisposing factor, it is a common form of osteoarthritis. Secondary osteoarthritis. When degenerative joint changes occur in response to recognizable local or systemic factor. Causes of secondary osteoarthritis. Developmental causes are hip dysplasia in endocrine acromegaly, traumatic or intra-articular fracture, occupational and meniscectomy. Inflammations are rheumatoid arthritis, gout, septic arthritis. Metabolic causes are alkaptonuria, Wilson's disease, aseptic necrosis, corticosteroid use, and sickle cell anemia. In neuropathies, syringomelia and diabetic mellitus. Miscellaneous causes are Paget's disease and Gaucher's disease. Constitutional susceptibility risk factors are heredity, gender or hormonal status, obesity, and high bone mineral density. Whereas in mechanical factors, the risk factors are trauma, joint shape, alignment, uses such as occupational and recreational. But aging is the most common risk factors in constitutional susceptibility and mechanical factors. Pathogenesis of osteoarthritis. Progressive destruction and loss of articular cartilage with an accompanying periarticular bone response leads to exposure of subchondral bone, which becomes sclerotic with increased blood vascularity and cyst formation. In a normal joint, healthy cartilage lubricated by synovial fluid cushions the bones and allows them to move easily. Here in this image, the synovial fluid and cartilage are not affected and diminished. Osteoarthritis causes the cartilage to begin breaking down, first making it thinner and then creating cracks in its surface. In this image, you can clearly see the cracks in the cartilage. Gaps in the cartilage can expand until they reach the bone itself. Here you can see the cartilage is slowly diminishing, and this cartilage diminishes until they reach the bone itself. When this cartilage is completely diminished, then there is a chance that synovial fluid leaks into the cracks of the bones. This causes further damage, and in some cases, they can lead to cysts in the bone or other deformities. If osteoarthritis is not treated, then they can damage to the point where the bones in the joint become seriously and permanently deformed. What are the signs and symptoms of osteoarthritis? They are pain increases with activity and worsens at night. Morning stiffness less than 30 minutes. There will be swelling and deformities in the bone, joint instability, and there will be loss of function. Neurological signs if spine involved. Crepitus and muscle wasting. What is the diagnosis of osteoarthritis? There is no blood test for diagnosis of osteoarthritis. Instead, blood tests are performed to exclude diseases that can cause secondary osteoarthritis, as well as to exclude other arthritis conditions that can mimic osteoarthritis. The main way of identification of osteoarthritis is the X-ray examination. The common X-ray findings of osteoarthritis include loss of joint cartilage, narrowing of the joint space between adjacent bones, and bone spur formation. Here are two figures to differentiate between a normal knee joint and the knee joint affected with osteoarthritis. In normal knee joint, a space is maintained between the adjacent bones where synovial fluid is present, whereas in figure 2, the synovial fluid is diminished and whereas in figure 2, the cartilage and synovial fluid are diminished. It can be identified by the presence of narrow space between the adjacent bones. If you have any doubts or want me to improvise, let me know in the comment sections below. Thank you.